and he is a nurse working at the NHS. And perhaps you could, he's going to share a little bit of his experience
Yeah,
throughout the years and struggles. Perhaps you could give us a bit of an introduction.
yeah. My name is Joan, but people call me Joe. I was born in Spain a long time ago, but then, like a lot of international nurses, I couldn't find jobs in Spain, and I moved to the United Kingdom, in England, and I've been working in the national health system ever since. I specialize in critical care patients. I mean, I started working in A&Es, and then in intensive care. And then by chance, I moved into primary care, and then I discovered quality improvement. And since then, I have worked on a national projects. I have transformed some projects transforming the sepsis, how we approach sepsis, how we approach also the flu vaccination. Another project that have had a big impact and in a local level, national level, and also international level. I'm also quite creative. I think outside the box, and some of my projects have won me multiple awards. And I'm also quite visible on social media. I was one of the first nurses who decided to start um, taking my content and doing some education on Facebook, Twitter, when it used to call Twitter, and other platforms when
Mm.
no nurses were there. And because I say, instead of asking people to come, why do I? It's better if I go where the people are. And then and that initially, they told me that no, that's not possible. But then when the people and the managers especially they saw the results, then I'm a bit of a rebel and I like to break molds and a bit, and always for one reason is when I'm a nurse, they teach me if it's right for the patient, then do it. If the system is not fit for purpose, then change the system. Is that what I normally do? And I will always do if it's the right thing for the people. And that's what Nelson Mandela always say: if things impossible until somebody done it. And I'm one of these people who always say, why not? Let's try it.
Yeah. Yeah, this we have in common. That's what we're also trying to do at everyone.org. When the system is failing patients, we try to find the right way
Yeah.
to reach them. Um, Today we're going to talk about several topics, and perhaps we can start a little bit with well, with the patient experience in general, and a little bit of your opinion on that. Uh, as someone who has worked in the front lines of the NHS, what would you say are the most frustrating barriers that you've seen patients face when trying to access care?
Here in the United Kingdom, we are very privileged. We have a free healthcare system in the point of access, but that also comes with some barriers, um, because here, like most of Europe, our population pyramid is upside down. We have more people that they are older, and we in the last century, we medicine and healthcare have been very good and making people live longer, but unfortunately, they live with long-term conditions. And people also assume that the NHS will sort it out. If you have an illness, we'll sort it out. And
Mhm.
we don't have unlimited resources, and sometimes there's a bit of a waiting list. Like it's happened in the last few years. Um, that people needs to wait over a year for minor operations and everything. And that's also a barrier that frustrates them. Is also what also frustrates me from a nurse point of view, from a healthcare worker, is that it seems that society have evolved to the 21st century, but the healthcare system is still in the 20th century. Sometimes I think in the 19th
Mm.
century, because on my daily life, I my bank to buy things online, but when I go to work, I'm still using pen and paper, and it's
Mhm.
only until 2 or 3 years that the NHS still using fax machines to fax, to fax papers from them to the GP. The IT systems in the national health systems are quite outdated and they don't talk to each other. It's quite difficult for a
Mm.
patient. For example, if I go to my GP and my GP think I have some problem, refer me to the hospital, that referral go to another system, and then the hospital, then they take a while. But then if I need an X-ray, then I go there. The system don't talk to that system, and it's very patchy. And from a
Mhm.
clinician point of view, to be able to see the whole of the problem of the patient, you need to get in and out of five, six, seven IT systems to be able to have a proper view, and that that creates problems. And one of them, that you can
Yeah.
miss diagnosis, and you can miss something, and also delay also the flow of the patient. And the last thing for me that the barriers to success in care is that we have a system that is very reactive. Everybody loves to play hero. Everybody, if you ask people who become doctors, nurses, and everything, they love to make a difference, to take care,
Mhm.
and to save life. Um, that concept is very expensive, and we have moved from we need to move from the reactive system to a more preventative system, because we need to prevent people to get in the hospital. People think, and politicians think, oh, headlines, oh, like Boris Johnson during the last election, we're going to build 70 hospitals. But that's not the real where the problem is.
Yeah.
You need to prevent and the people not to arrive to the hospital. And prevention at the moment here in the United Kingdom is not very good. We're very good at reactive, but because we have saturated the system, sometimes it takes a long time to be able to save that, to put that people right and back to work. And that's why we have um,
Yeah.
a waiting list the last time I think it was nearly, well, I don't want to say numbers, but it was a lot of people um, not being able to work because we're waiting for something to happen that it
Yeah.
was not happen. But yeah, that's for me the main problems we have as a patient experience. Sometimes the frustrations that nothing seems to flow, uh, and you need to fight all the time
Yeah.
for the next step.
Yeah, and what you're describing also sounds like, well, not the best environment to innovate. Also, from the perspective of the physician, to think out of the box, because if the daily process is so complicated, then it's
Yeah,
difficult to think outside it.
you just touched one of my biggest frustrations that I have in the NHS, because I'm quite my mentality is, oh, something's not working. Let's try something. The NHS is the most risk adverse that system. I don't know if other health systems in Europe, but if there's any chance that something will go wrong, they put 25,000 barriers for you to try it,
Mhm.
and say, well, what about if we go right? Quality improvement is about trying and cycles, and if you don't work well, they try something else on a safe environment. But
Yeah.
this very risk adverse on that, and one of the worst things you can do is like Einstein always say, the concept of insanity is to carry on doing the same thing and expect different results. You need to break that circle. Unless you do something different, you will not be able um, to, uh, to to change the things. And the population has changed, the illnesses also have changed, have evolved, but the way we care for the people is still the same. That means a gap between,
Mhm.
we are always behind in trying to to fulfill our duty of care, because the that the society have changed, but it takes a long time for the health system to
Yeah.
adapt to a new environment.
Yeah. Yeah. Unfortunately, that's true. Beyond the
Yeah.
UK, it's unfortunately a legacy problem for a lot of healthcare systems that we're going to yet see the results of, or the consequences of. Um, do you have any? Well, I'm sure you do, but would you like to share any specific patient experiences that have stuck with you, where it was very
Yeah.
obvious how the system has failed patients?
For me, one of the biggest stories that I impacted me is a patient that I knew from quality improvements, who used to be in a wheelchair, and he died for sepsis, because it was misdiagnosed of sepsis,
Mhm.
and they took a long time to realize that it was sepsis, because it was non-verbal, that patient, and the signs they didn't do, despite the mom telling them, my son is not right, my son is not right. By the time they did the test and everything, it was too late, and that patient is called Adam,
Mhm.
and Adam used to be a poet. He used to write poems, and some of the poems were, they touched me about his experience and everything. And the mom, I had a conversation with her and about her experience, and that's when I decided to get involved in sepsis
Mhm.
and to make it. What can I do to make it easy for patients and for the staff to recognize sepsis? And I got involved in a project that's called Calling Goodbye Sepsis, and I transformed the pathway. I'm very visual, and I did easy steps, what you need to do, and everything, um, and it worked. My hospital for went from one of the middle results to one of the best in the country. But
Mhm.
for me, the best thing it was that after 2 years of implementing that system, the number of people admitted to intensive care for sepsis dropped significantly, and the length of stay of a patient that they were in the hospital because of sepsis also dropped. That means that for early intervention, we come back to prevention is better than the cure. From
Mhm.
early intervention and identify sepsis early, not only we save life, but also the quality of life for these patients going out of the hospital was a lot better. And for me, is the best tribute I could do to Adam, and that stuck with me. These other things, that's one of the ones who have been involved more closely and touched me closely. But um, you can see in our health system, like lately is Martha Law. Again, is a patient who the doctor misdiagnosed the patient,
Mhm.
and the mom wanted a second opinion, but the doctor refused, and the patient died. He was also a youngster, and since now they have passed a law that the patients or the parents or the relative, they have the right to have a second opinion.
Mhm.
It's all this, but for me, it's frustrating because we only act when somebody die or when a big disaster happen,
Yeah.
and we should be more proactive, and we should be able to put some in system and not to put our hands in the head and say, oh, what are we going to do now? That's why I'm sometimes very frustrated. The real change only happen when people lose their lives. But yeah, that's two of the things
Yeah.
that stuck with me.
Yeah, no, and unfortunately, you're right. And do you think that the part of the difficulty in, let's say, working on prevention rather than being reactive, has to do with the lack of resources, whether it's mental resources? Everybody's overworked, of course, in the system. So,
Yeah, I have a clear example that we're talking about how the healthcare system have evolved. When I qualified, that's a long time ago, nearly 30 years ago. Don't tell anybody. Um, I used to be on a ward. The length of stay of a patient used to be a lot longer, and I used to have my patients, 8 patients, but six of them they will be mobile, they will be ready doing physio, and I used to have two of them that they need a bit my attention, and that's how I cope. Now, if you go to a hospital, you still have 8 patients, the same number of patients, but all 8 are acute
hmm.
because the length of stays is a lot shorter, and the patients they go home, they discharge home a lot quicker because the kind of operations have changed. No, normally now all of them are keyhole. They're not as invasive as before. I mean, the the number of actions that the nurse needs to do and the acute of the patients are a lot higher, but you still have 8 patients and you need to divide now your attention with all the eight patients, and sometimes you feel that you cannot give a care that you wish because the volume and the intensity and the acuteness of the patients are a lot higher than it was 20 years ago.
Yeah, I can imagine. I can imagine it's difficult to to deal with that in a lot of healthcare
Yeah.
systems. And you mentioned already the second opinion law. Apart from asking for a second opinion, what is there anything else that you wish more patients knew, that they could try when they feel that they're stuck or out of options, or they're not getting the care that they wish they were?
It's a bit difficult, because I'm quite a bit radical, and I always say the patient is always right and the relative are always right. But we live on a system, on a healthcare system that, um, the doctors still have the power, um,
Hmm.
and the power is concentrated on a few doctors. And we still, in a society, we it's changing a bit, but we still in a society we still believe that, the doctors know best, and normally they do, but you don't you don't challenge them. And I always say, well, you don't always doctors know the best. They're humans. Sometimes they can misdiagnose and everything. If you think that is not right, just have a conversation, not to do that, but ask. And that's why I'm so happy now they do Martha law, because you can ask a second opinion. Or and if you also here in the United Kingdom, you could, go. It's a thing called, choose, um, book and choose. I mean, people think that they need to go to your own GP. You don't. You could go to, if your GP you don't think is listening to you or anything. You could go to another GP in another place. And also this sometimes, if you think, in your region, for example, I live, in Yorkshire. My I have a knee problem. My knee operations, they take 12 months, but in Scotland, for example, it's only 1 month waiting list. I could ask my GP, can you refer me to Scotland? And then I go to Scotland, I have my knee operation, for a week, and then I'll come back. The people needs to learn to be a bit more mobile and think outside the box and say, okay, in my area, I'm not receiving good care. Can I try other areas, and can I play the system, and 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 and, and jump in a way, it's way to jumping the waiting list, but in a way that it benefit everybody, because, you have your operation early, and also then you will mean that you will back to work and everything. Everybody will benefit of that, but not a lot of people are 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 knowing that the system is a bit more flexible than it is.
I think that's a very important point that you're making. And yeah, thank you for that. And do you know that, I mean, recently there has been also a lot more going on in terms of teledoctor platforms. So getting
Yeah.
a consultation online. Do you think that that is also a reasonable alternative?
Yeah, I think it have its place, but, what I don't want is that people, like a lot of people do, to thinking that, Google your illness, you are an expert on your illness. Doctors spend 10 years, at university, and they spend a lot of years, to be experts of their conditions. For you, 2 minutes on Google, no. But this a lot of IT that, for example, today you and me are talking from a different countries, and we have a conversation. If I have, some conditions, I could, have shown you on the camera. If I have a rash on my face, and
Mhm.
there's some space that IT could break barriers and also make it cheaper,
Yeah.
because, well, I'm having a conversation with you here. You could see more patients online, and instead of going to, for example, in my house bound, I could sit in here, and instead of you coming to me and spending 20 minutes on the road, then park the car, coming to see me and everything, on that space you could see three patients. That's why the IT is there, but it needs to, people realize that, um, they need to go, to platforms that they have, doctors behind, and
Mm.
they're not, somewhere, they have a credentials that they've been accredited, to be able to do that online, and they are, some of them, that you can do it. The GPs also, and the hospitals are going to also some, online consultant. The online thing, is growing, but
Yeah.
also it's not for everybody. Um, father-in-law, my mother-in-law, they don't even have a mobile phone. If, you ask them to have a consultation online, they don't have a computer. And sometimes we assume a lot of things, and
Yeah.
just because it's cheaper and more accessible, sometimes we forgot, a small group of population that they cannot, access to IT computers. it's getting less and less, but
Absolutely.
still some people who don't know how to use computers, and despite living in the 21st centuries, and we need to make sure that every time that we put a system, we try to be as inclusive as possible.
Yeah, yeah, no, I agree. That's a very important point. And online as well, you have spoken about your own health and mental health struggles during the pandemic specifically. How did that experience shift your understanding of what patients go through?
Yeah, mental health is a thing that, um, if you asked me 5 years ago, I wouldn't talk about it. Uh, because I come from Spain, is a bit of a macho culture, and
Mm,
when if you ask any of the children when you grow up, what do you want to do? You want to be a footballer or a matador? With the bulls and everything. And it's not a thing that we discuss. And also, amongst men, it's not a thing we tend to discuss about it, because we have this sense that we need to cope whatever they
mm,
happen. We still this old-fashioned way of society that we need to be strong to be the head of the family. That's all the values that I brought from Spain, and they're a bit similar um, in England, but in Europe, still a lot the society um, goes around for the man, to be strong and everything. And I when I first had my first mental health problem, I was burnout. That was in 2018.
mm,
I didn't tell anybody. I felt so ashamed. I just went of sick, and what I told people is I was in between jobs,
mm,
and I felt that I was a failure, that I was not a good nurse, and because I thought, um, as a leader, also because I was quite senior in my position, I couldn't show weakness, and I thought that I was being weak. I felt also quite a bit ashamed of having problem with the mental health,
yeah,
and then I didn't tell anybody. Then after 3 months, I come back to work, and like pretend that that episode of my life never happened. I never told to anybody. But then pandemic came, and I wasn't ready for that roller coaster of emotions, because I left my senior position in the hospital, and I volunteered to go back to intensive care because I had experience in intensive care. I worked during the two waves in the intensive care unit in my hospital, the COVID intensive care. Um, I went from happy to sadness to saying goodbye to children, to the parents, to somebody opening the eyes. It was like a roller coaster,
mm,
all in one shift, and I couldn't cope, and I started having a bit of a panic attacks by the end of the second wave, um, and because also it was very intensive, and I was tired. I had a lot of broken nights because I used to wake up with sweating, say, oh, I forgot to do something of my patients, or and then
yeah,
and I used to, you know, and then used to go back the following day, and the patient that you were carrying suddenly was an empty bed, and then you think, oh, I've, is that because I didn't
mm,
do something, and because the patient next door he was alive, and it was a lot of unknowns that nobody knew, and nobody and then I was questioning myself every day, and I ended up
yeah,
because and there was a cycle started because I didn't sleep properly. I was very tired, and because I was very tired, there were long shifts, 12-hour shifts, and putting the PPE and everything, everything could mean that you get COVID. I mean, every mistake, and the more tired
yeah,
you are, the more the more the more chances is that you have a mistake. And the problem also, if you are tired, also you don't tend to of getting exposed to the disease gets even higher. By as I say, by January, PTSD, and because of COVID, and I started counseling and sessions and everything,
mm,
and that um, suddenly realized that. I neglected my mental health, and I realized that the mental health is nothing to be ashamed of. It's just health. Like the physical health, if I wake up in the morning, I have a headaches, I take a paracetamol. If I wake up, um, if I don't do anything to remove um, some of the stress, I will accumulate it. And
Mhm.
because nurses, we tend to be like a sponge. We absorb all the bad emotions from the relative, the patients, because normally when we meet these patients are in a bad situations, and we tend to absorb that, and we are not very good on offloading and
Mhm.
taking it out. At what point I got saturated, and I realized that I needed to do something to offload.
Mhm.
But I learned that from my therapist, and since then I become a big advocate of trying to tell other patients, especially male, sorry, patient, healthcare workers,
Yeah.
especially a male, that nothing to be ashamed of your mental health. Everybody have mental health, and you need to take care of your mental health every single day, like you take care of your day of your physical health. If you put some weight, then you do a diet or you go exercise. If you have an stress period at work, you need to do something
Yeah.
to alleviate this stress. Some people do yoga, some people do meditation. I discovered running, um, and that is my space that I do some running and everything. But you need to do something every single day. Otherwise, we accumulate and then you have a crisis like I did.
Yeah.
And what we try to do is to avoid crisis, because if we don't take care of ourselves, it's going to be a moment that we not be able to take care of anybody else, because it's impossible. We are not superheroes like people think, tell us
Yeah.
sometimes during COVID and everything. We are human beings. As a human beings, we every day we experience traumatic situations with other people, and unless we do something about them, then we arrive at a point of saturation. And
Absolutely.
especially and then since then I've been working with charity and everything, because um, the suicide in nurses is 3 times higher than in the normal population. I mean, nurses committed suicide, especially male.
Mhm.
The chances is around, I think, three or a bit even higher than that. And I my experience told me that I have a position that I have visibility, that I needed to take the taboo about mental health, and because also um, what I experienced then from a patient point of view, I got, I got a lot of better understanding all the stress and things that the patient go when they go to the hospital, and
Yeah.
when they become ill, and they don't know what's going to happen to them, all these unknowns that suddenly I had. I think I've become a lot more sympathetic of people not being well, and also to try to do something every day
Yeah.
for your mental health.
Yeah.
Um, that's why now I become a bit a massive advocate of just stop thinking that because everything I did, I was a failure as a dad, as a nurse, as a husband. But actually, I think realizing and taking care of my mental health, I have become a better person. I have become less
Mhm.
stressed. I have become less, um, uh, a bit more. I don't know, more approachable. And I
Yeah.
think I think I'm a better nurse also for acknowledging my emotional side, because
Mhm.
I still remember on my first job um, with the matron, when I arrived to the hospital, I had a fight with my girlfriend at that time, 20 years ago, and I was a bit teary. I think I broke up with my girlfriend. I remember going to my shift and being on the staff room, and the matron came and say, "Joe, what's these tears on your face? When you come to the hospital, you leave all your problems at home. I want you no emotions. You need to be professional."
Mm.
That stuck for me. Then
Yeah.
me for me being professional will make means not to having emotions, and it's quite difficult
Yeah.
not to have emotions. But for 25 years, when I'm at work, I was trying to be non-emotional. It's impossible.
Yeah.
It's impossible.
I can it sounds impossible, especially in the line of work that you are in. It's
Yeah.
yeah. Yeah, what you're mentioning in terms of taking care of mental health for people in healthcare, it sounds like another element of, let's say, potential prevention,
Yeah,
that is perhaps not getting enough attention or as much as it should. But of course, through activism such as what you're doing, hopefully it will get more exposure and it will get talked about a lot more. Um, do you think what you've gone through and the way that you see mental health in your profession and your experience right now, do you think that it has, well, helped you to notice also, the mental health difficulties of patients as they go through care and be more alert to that?
uh, they do because we still our healthcare system is still very much focused on physical health
Mm,
and repair the system, repair the organ of the part of the body that is not working. But sometimes the emotional side is also linked very much with the physical side, and unless we also do something about the emotional side, um, the patient will not heal properly and it will
mm,
come back to probably with some other things. I realize that they need to have a balance with the mental health and physical health. And and during COVID, I realized also the importance of mental health because I had patients who um, they wanted to leave, and for miracle they survive. And patients who they were fighting for their life, and and they decided I had enough, and they
mhm,
didn't last more than 24 hours. And you look at these two patients; they were very similar, similar age, similar. One of them decided wanted to carry on fighting. The other one gave up, and it's same treatment. And I realized that the power of your
yeah,
mental health, treat the patient and take care of also of this side of that the chances of surviving will be a lot higher than despite all that. That's but the problem is as a nurse, they didn't teach me a lot
mm,
on my nursing career how to treat that side because even in the United Kingdom we split adult nursing and mental health nursing.
mhm,
Uh, it's two completely different branches of nursing, but I think they should be together. I think I love to learn more about mental health and
yeah,
obviously not to be an expert, but enough to be able to treat the patient, the emotional side a lot better
yeah,
instead of going with good instinct and my own experience and everything. And also the services are quite hit and miss on mental health. This more, it's nearly 9 months here in where I live in Yorkshire, 9 months to be able to accessing talking therapies.
yeah,
And when you have, for example, you have a trauma um, with your body, you have an accident and everything, you have a trauma, you see somebody die, and the patient, yeah, maybe heal physically, but the mental side also needs to heal. And if you need to wait 9 months to access to mental health services, that have a huge impact also on the physical health of that patient.
yeah, absolutely, absolutely. And is the I mean, I'm guessing not, but is the waiting list for getting mental help any different if you are coming from within the healthcare system or?
I was lucky that during pandemic we had a psychologist in the unit,
Mhm,
but my frustration is as soon as we came out of the pandemic, that was removed. I
mhm,
think every hospital they should have on occupational health. You should have a counselor. You should have somebody when a staff could go and talk to them because
yeah,
we don't have that. If I have an anxiety or problem, I need to go to my GP. My GP needs to refer me to mental health therapist or talking therapist. And as I say, it's nearly 9 month waiting list for that. It should be an especially a doctor, somebody specially trained in any organization, in any health organization, where you can go and access
yeah,
this person, especially if you've gone through a traumatic experience on your work, somebody died or somebody um, anything that it caused an impact
yeah,
on your mental health. You shouldn't need to wait. You should be able to access some counseling or some kind of therapy there. And like sometimes they do at schools. If it's in America, if it's a shooting or something, they normally a psychologist go to the school and
Yeah.
they spend time with them. We don't have anything like that. They they expect us to be resilient, and they
Yeah.
expect us to go back to work the following day and pretend that nothing happened. That is impossible, and
Yeah.
will have an impact on ourselves. You need to be able to offload, as I say, and at the moment the system is not very good at that. I love. I think I learned from Netherlands. I think the Netherlands have the healthcare system. The nurses, they can have up to 5 days of mental health day. They call it,
Hmm.
and they don't need to tell why. They can have. They're not part of the annual leave. I think they have a specifically mental health day that they can call them and say, "I'm taking a mental health day." I think that should be also in the United Kingdom,
Yeah.
because if you've been caring for a patient and that patient die, um, you cannot go home, sleep, and then come back at 7 o'clock in the morning and pretend that nothing happened. You need time to heal, to recover, and I think we should follow example of the Netherlands and put some mental health days
Yeah.
in our in available for anybody who needs them without
Yeah.
asking any questions.
Yeah, absolutely. Yeah, I agree. And I mean, that is perhaps the minimum to start with, and then what you were
Yeah,
mentioning, having somebody available for medical stuff to help out, because the pressure and the emotional weight of what people in healthcare have to go through is, of course, 10 times larger than
yeah.
anybody else. So also the care should be reciprocal, I believe. And if we switch towards maybe more, well, because all of this, the context that you've been providing so far is a context of, well, a system where, let's say, people within the system are also not necessarily always in a position to think outside the box, and
Yeah,
is it is to some extent it's very understandable, and it's not a matter of, oh, they cannot or they don't want to. It's just that sometimes it's a physical or mental capacity that they don't have. But what are your thoughts in terms of, let's say, for patients to explore, well, if there are safe and legal ways to access treatments that are not on the NHS, that have not been part of the system yet? Is that something that that well, how do you feel about it, basically?
I feel that for putting, I normally like to put in the shoes of somebody. If somebody have diagnosed me of an illness, the first thing I will do is to see what treatment can I have. And if you go in the United Kingdom, we have some treatments that have been approved, and they approved by an organization called NICE. But sometimes that process takes 6, 7 years, and these treatments in another parts of another country that they already been through this process and they're available for patients. To be honest, I don't really care where the treatment is. I want to have
Mm,
access to it because I want to get better. And I don't, sometimes I cannot wait 7 years
mm,
for this treatment to be available in the NHS. I will, if you ask me if that gonna um, improve the life of myself or the life of nobody who I love or who I care, I'll go anywhere in the world where I can get a treatment that always needs to be approved and needs to make sure that is
yeah.
have the authorities. But this country, the problem is at the moment. Uh, each country is in a different stage. Australia,
Mm,
they can some of treatments are approved. Then you go to United States, other treatments are approved. They're not. We're not playing an equal field. And to be honest, if it's anything I can do to support these patients to get the right treatment at the right time, I move
mm,
for it. Let's remove
yeah.
barriers. We live on a moment that I can talk to you from my home, and you in the Netherlands. Then I could, if I know that is a treatment available in the United States, and I can talk to a pharmacy in the United States, and then go to my GP, and my GP say, I saw this treatment, it's been approved, but it's in the United States and it's backed up by a pharmacy and everything. I just need a prescription. I don't see any problem with the GPs prescribing this
Mm,
treatment. I will demand as a patient, I need that treatment.
yeah.
Obviously, I know that it's not approved by the NHS. That means that probably I need to pay for it. But I'll what costs do I put to the health of myself or my loved ones and everything?
Yeah.
I, then we need to remove barriers. And
Yeah.
if a treatment available that is proof and backed by the science that is work effectively, um, just if you're if if you're prepared to pay whatever it costs and everything, just do it. And
Yeah.
a lot of also people fundraise. There's a lot of people who here in the United Kingdom at the moment they because some specialize in another countries they do a lot of fundraising and then they go to another country and they have the treatment in there. Why not medicines? We can do the same with medicines. Bring the medicine from another country that they passed all the tests and everything,
Yeah.
and also will be beneficial for the society, because if I can get better with the treatment coming from another country that pass all the safety standards, and then I will get better, that means that I will be part of the society again, instead of waiting 7 years and having treatment or palliative treatment or treatment to just to resolve the symptoms but
Yeah.
not tackling the problem. That also costs a lot of money, sometimes more than
True.
the treatment itself.
True. No, absolutely. And I mean, that's exactly why we, as everyone at work, also exists because, well, it's all started with a personal story where an ALS patient was trying to reach a new medicine that obviously not there's no cure, but they could have given him a bit of a longer time, let's say. And it was only approved in the States. Couldn't he couldn't access it in the Netherlands? It was going to take years, and eventually he could not wait long enough. But what we see is that the legal framework actually exists. It's just that a lot of patients and a lot of doctors as well do not know that, and they don't feel that
Yeah,
they're confident to prescribe a medicine that is not approved locally, even though it's been approved somewhere else, and there is the information about clinical trial results, etc. Because at the point where it has an approval somewhere, there is
yeah,
already some information that you can base your decision on. It's not a that's an experimental drug at that point.
yeah.
But we find that a lot of well, doctors and patients are not aware of that.
But that's for me is one of the biggest fears that that I have is where do I look at, because there's a lot of fake medicines on internet. That's
Mm,
why um, if there's any resources or any website that I could have a look, that's why I got very excited when I realized that that your company existed. Is because uh, is a reputable source that you have the homework. It's not going to be a medicine that they promise that you're going to be 10 foot taller and like sometimes you find on internet and you Google and
yeah,
then they come back to you and then the side effects are well. Some people have died for getting medicines from an unknown source from the
yeah,
internet, and that is the biggest fear. But if I know that is a place that I can explore safe all these other medicines and they have an approved in and everything, and that for me is that's why I'm a nurse also to make a difference.
yeah,
If I cannot make a difference in my own country, let's see if another country have they have something, because a lot of the things a lot of the things that the patient wants is to have what can I do next? And it goes very linked to the mental health. If the patient know that is a treatment available in
mm,
another country, that also will improve their hope, they improve their motivation, and they will improve their mental health and the willingness to carry on fighting and not giving up. And the
yeah,
prognostic by knowing that is not probably they improve the prognostic quite a lot better, because the mental health also go together with the physical health. And if I have these barriers and tell me, look, it, uh, your treatment is not available in this country, then you just say you give up and say, okay,
yeah.
what can I do now? That's why I think it's it's quite exciting the idea of exploring what other treatments are in the world, and if it's something that suit me or on a patient, just
Yeah.
get it. Why not? And you know,
Yeah, and it's crazy. Sometimes we see people get on a treatment and get better, and people in their country still continue to wait for years to get
yeah,
general access to that treatment, which is just completely unfair. but it's the way the system is set up at the
I
moment.
know it's frustrating because why cannot have, the trials, they take a long time for the clinical trials to be
Mm,
approved. If it's been approved in America and they pass all the trials, why cannot also be have a license globally? It's some you need to have a license also in the United Kingdom. You need to have a license for
yeah,
Europe, and each one of them they need to have their own studies, their own thing. If you have, there needs to be a world standard now. The world is very small now. We can fly. I can
yeah.
fly to to the other side of the world in less than a day. It should be an organization who give licenses for a worldwide medicine, and
Yeah.
instead of waiting license for each country. Sometimes bureaucracy is the worst enemy of humanity,
I
and I come
agree.
from Spain. That bureaucracy is always very high.
No, I agree. And I mean, in an ideal world, this is exactly how we would imagine
Yeah,
it, that if it's approved, it's approved and
yeah,
anybody should be able to get it. But in reality, I mean, there are so many barriers, even when a medicine is approved by the EMA, for example, so throughout the EU, still the amount of time that it takes for individual countries within the EU to make it available
yeah,
after approval, it can vary from a couple of months to up to 5 years sometimes. So I mean, that is also another level of the bureaucracy that is maybe less visible, because you think, oh, approved, I should be able to get it, but that's not always the case, unfortunately. But do you think that more clinicians should be aware of of how named patient access, so access to medicines for that are not approved locally for individual use, how it works? Do you think that more clinicians should be aware of that?
I think everybody should be aware, not just clinicians and patients. Everybody should be aware that think outside the NHS, think outside your healthcare system. Um, if you do your research and you think it's a drug that helps and is licensed in another country, you just go. You should have the power to go to a GP and say that. The GPs also should have the power to think, okay, I have this treatment, because a lot of doctors go to an international conference and they do a lot of
Mm,
cases and everything. They come back to United Kingdom and they say, oh, I know exactly what you need because I just been to United States and this pharmacy in the United States, but unfortunately I cannot give it because it's not licensed in the United Kingdom. How frustrating is that? You should be able to have the power. Okay, but let me do a prescription. Let me put you with this organization, and they may be able to get you the treatment, and then
mm,
may be able to follow you up. That for me, it should be compulsory to all the doctors and everybody to know, and to think. Okay, it's not available here. It's anywhere else I can get it, and make my patient better or make myself better or my relative. Uh,
yeah,
uh, it should be compulsory to every nursing school, every medicine school, and everything to have um, a chapter of education that they call about global health
yeah,
and to know where to find the resources and because the resources are there. Sometimes they're not available in your own country, but
yeah,
you need to know where to look for.
yeah, that's
Sometimes we
true.
have a bit of a blinkers, and we think that if it's not available in the United Kingdom, it don't exist. Well, it is exist.
Yeah, sometimes it's closer than you think even. But okay, and to we've discussed a lot of things in covering a lot of topics, but maybe to give it a bit of a, let's say, positive positive ending.
Yeah.
What gives you hope, despite all of the challenges that we have discussed in the system, and there's plenty more that I'm sure we haven't touched upon.
Well, I got a lot of hope that the science is evolving. If um, if for Marie Curie or Florence Nightingale wake up suddenly and so the 21st century will be quite impressive of what we have
Mm,
achieved in less than 100 years, with diseases that were deadly 50, 60 years ago, now we have vaccines for them. I mean, I have hope that we carry on with this evolving and getting more medicines and more treatments for illnesses. Hopefully, I'm hope that soon will be a cure for cancer and we'll be able
mm,
to with genetics and the new AI and things we'll be able to detect cancer a lot easier and also to modify the defective cells and everything. There's a lot of things that they promising the future will be a lot brighter. I mean, for me, sometimes I cannot keep up how fast the new inventions occur, and that also part of the problem with the health system, that sometimes they cannot catch up with the new treatments that are coming and everything. I have uh, hope with that. I also have hope that, and I think the people needs to take a bit more responsibility of their own health. For me, one thing I will do is to introduce first aids and basic treatments onto school curriculum. We, my generation, I, I only go to the doctor if I'm really serious. You see, younger generations, they have pain on whatever, they just go to the doctor. They say, oh, they expect everything to be sorted. People are not taking responsibility for their own health. I'm hoping, and that's unsustainable. I'm hoping that at some point we go to prevention again, and the people will start taking care. Basic life support should be compulsory at school. Should be also first aids, how to treat burns, how to treat sprained ankles. All these things should be in the curriculum of 16, 17, 18-year old, to just to be able to give a health, like same as mental health should be part of this health program, should be an education. Well, people talk about mental health, and I'm hoping also that at some point we will have a magic tablet that, with some genetic medicine inside, that will put it in and go to the localized cell that is painful or is inflammation or anything, and suddenly deploy something, and fine, we're absolutely fine in less than 5 minutes. That, I can always dream, but as I say, medicine have evolved a lot in the last 100 years, and I think we only accelerating the fast pace, and with AI, um, I think the future, um, uh, will be not long till the majority of us will live over 100 years. That will create other problems, and we're still seeing now the problems. But let's sort other problems. Politicians can sort other problems, and just from a health point of view, I think we will have a health, hopefully, have a healthier society, living longer, but also living healthier. That's what I aim for. Because at the moment we're quite good at living longer, but sometimes not as healthy as we should be.
Yeah, indeed. Thank you very much. And indeed, I agree that there's a lot positive coming, and hopefully we will see it implemented in the best possible way. Also, what gives me hope from my perspective is also having the opportunity to to talk to someone like you who is very vocal about the difficulties in the system, and also taking proactive action
Yeah,
to spread the word and to seek solutions, because talking is one thing, of course, but being involved in actually doing something about it is the next
yeah.
step.
I always think everybody could do something to make things better.
Mhm.
A lot of people just sit and complain. Well, okay, you have your experience. What have you learned of your negative experience? What can you do better? And then talk about it, and that's how you start conversations, and things get better. Just sitting on your chair and blame the system and everything is bad, that will not go anywhere. I'm always seeking solutions, because we can always get things better. We're not perfect.
Yeah, no, far from it.
Yeah.
Thank you very much for this conversation. I really appreciate your time and your insights.
Okay. That's a pleasure.